Hey, welcome back to Floyd County Emergency Management. My name is Chris. Today I'm joined by some of our partners from the Department of Public Health. Tell us a little bit what you do with the Department of Public Health.
Thank you, Chris, for having us. My name is Rewa Presley, and I am the Emergency Preparedness Coordinator for the Department of Public Health, the Northwest District. And so there are a few programs that sit within emergency preparedness. There's an opioid program that sits with us, but we also have a medical countermeasures program. We also do training and exercise, and then we also have planning. And so what we do, and we have an affiliation with the hospital, the Healthcare Coalition side, or the Healthcare Coalition arm of emergency preparedness as well. But what we do as a whole is just make our communities safer and make them more resilient is our goal, and that we just help communities, individuals, populations within just be more prepared in the event of an emergency or disaster in their area.
My name is Dawn May, and I am the Healthcare Coalition Facilitator, and my role is to combine everything with Department of Public Health with the healthcare agencies and facilities that are in our district.
So what is it about about education that you like in the community?
Well, I think for me, I'm the product of educators. Both of my parents were teachers, and so there was a natural inclination toward education. But one thing that my parents always said was that education is something that that no one can take away from you. And so that being said, when we come into and we talk education in a preparedness sense, once we tell people something and we keep saying it, they get it.
Yep.
You know, and it may not be something that people are particularly comfortable with or aware of, but if we keep the message out there in various forms, if we keep it before people, then at some point people are going to get it. And then we've done what we're hired by the public to do. And that is just, it's to make people more aware of the dangers that they could face. And that doesn't mean that we want people to be paranoid, so to speak. It's not that. It's not to instill fear, but it's to instill confidence. And that's what education can do for you. The more you know, the more confident that you can be that if your family faces an emergency event, you can adequately, if you've adequately prepared for it, then you can adequately respond to it.
I think it's our job to empower people with knowledge.
Absolutely.
And some of the classes that we've been teaching with our community preparedness classes are CPR and first aid, which are very important.
Right.
Because during a storm, those are some of the injuries that and the fatalities that where they occur are traumatic injuries where somebody has suffered a massive bleed. So.
Exactly. And that's the crux of what we do. And we can never do that too much, and so we seek out opportunities to do just that, to empower our community in whatever way, in whatever format that we possibly can.
There's different variables, but how do disasters affect people in our community?
The emotional trauma for children can be catastrophic. I think the key would be to have a plan and to practice. And once you practice things, some of the fear goes away.
Exactly.
That's right.
Exactly. Because the more you do it and the more you're exposed to it, then you do lose that fear.
Practice makes not perfect, but better.
Makes it better. Absolutely.
For certain.
One thing that I like to tell people is to write down emergency phone numbers, actually write them on a note card, have your information written down, because guess what happens during a storm? The power's going to go out. And, of course, your phone is going to be on zero power. So
right.
It helps if you've got those numbers written down that you can maybe go to a gas station or you can borrow somebody else's phone, and you've got your notepad there that you can use those numbers. It's also important to know your medications and to have those medications written out, because if you have to go to the ER or something like that in an emergency, you should have that already prepared, right?
Right, absolutely. And you should also have emergency or backup, if you will, medication as well. You should have at least a few days, extra supply of medication in the event of a storm or or an emergency event, and you're unable to get, to your pharmacist for a few days, you do have some medication in place.
The emergency kits also help if you have to evacuate your home. Say there's a chemical spill that happens near your house and you have to evacuate, or a fire, a wildfire that comes in. Those kits help.
Grab and go bags.
Grab and go, exactly.
Yes, you should have clothes, shoes, blankets, things for entertainment, for the kids, for the dogs. Those things you shouldn't be throwing into a bag at the moment of the disaster. It's something that should be there in place, and you grab and go. If a tornado comes through at night, it's dark. What are you doing?
Yep. Cash. Do not, if you have cash in your emergency kit, do not go in there and use it just because you need to go get a gallon of milk.
Exactly.
Forget it's there. And if you need it, you go and get it later on.
Right. And one thing I want to emphasize, though, because sometimes people do think as well that, well, especially, if you're having some economic challenges, well, how am I going to buy water for an event that I'm not certain is going to happen when I can't buy milk for my children for tomorrow? And so that's one of the things that we want to start to educate people on, is that, again, that financial resiliency piece, but just taking a little bit of every paycheck and just building up.
Exactly.
Start somewhere. Just because you don't want to be in a position or a situation where you do have to potentially evacuate or leave your home, and you don't have any reserves set aside.
Because the last thing you want to think about in a time like that is, how do I feed my family, or how do I do something? That should be something that's already taken care of and prepared for.
It may be days before someone's able to get to you. What are you going to do in those days? Because, you see on national news with several of the storms that have came through lately that, they're like, where's my water? Where's my food?
Yep.
We have nothing to eat. But it's 2 days out from the disaster. You should be self-sufficient and self-reliant and have that resilience for yourself until help can get to you.
You have to be able to care for yourself in times, because if something comes through and it's just widespread, then police, fire, and EMS are going to be everywhere.
Right.
So
Individual responsibility for sure. And one thing as well, Chris, that we want to talk about, is communications and the ability to communicate. One thing that we're aware of as well is that if something were to happen, let's say on a Thursday afternoon, the middle of the day during a school year, your children are at school, you're at work, you may be in 2 separate parts of the same county, or you may be in 2 different counties altogether. And if something were to happen, how does your family still communicate? Does your child know your name and not just know you as mommy and daddy, but do they actually know your name? Do they know their address? Do they know phone numbers? So those are things, and should something happen and your family loses the ability to communicate, what's your backup? So those are things that people need to think about, as well. What does that communications piece look like? Because there's obviously a fear within the moment of the event anyway, but then there's a heightened level of desperation if you cannot reach the people that you love. So you want to plan and practice ahead of time what that communications plan needs to look like for your family, just to make sure that you don't find yourself in that situation.
With Rewa's scenario, with a incident that you're in one county and your child's in another county, so communications are down everywhere. How do we know who's safe and where they are? So an out-of-town contact in an emergency situation would be that person that you would want your child to know that number, and then you call them. Okay, yes, they've called, they've checked in, everybody's safe. That's your outside way to make sure that everybody's good.
At the end of the day, it's going to come down to how you've taken care of yourself and your family, and how you've looked after your neighbor, and vice versa.
Yeah, let's look at our neighbors. Do you know who you live around? There may be somebody in your community who is not able to care for themselves.
Right.
So I think it's important to know who they are and if they need help.
And if they're elderly, if we've had a storm
Exactly.
come through and they can't get out of their house, they're wheelchair bound, they're dependent on medical equipment, those would be the first people that you would want to on your street to get to.
Absolutely.
And,
Great point.
Floyd County has an awesome system with 911. If you have a special needs child or if you have an aging parent that has dependency on durable medical equipment, ventilators, things that require power, you can fill out a simple form and they can have it on file for 911, for the police, for everyone,
Right.
to know, okay, I mean, you can even report what medicines you're on.
Yep.
But to your point, though, about knowing your neighbors, though, and the ability to share resources.
Right.
And because you never know who you're going to need or what you're going to need necessarily in an emergency event. But if you get to know your neighbors in advance and, just develop a strong network, on your street, on, your block or, your subdivision, whatever the case may be.
It takes a village. Yep.
It really does. And the ability to be able to share resources and, and to encourage and strengthen one another in a time of need.
Great. Well, thank you all for joining us today. We hope that some of this has been a help to you. If you've got any other questions, you can reach out to us at Emergency Management, or you can also reach out to the Department of Public Health. Thank you for being with us. Thank you.
Thank you for having us.
Thank you
Partners,
for having us.
y'all have a great day. Thank you.
Thank you.